understood.
Okay.
But,
That was before she left town, right?
oh yeah, long time ago.
Yeah.
When my dad was still alive. Long before that, yeah.
Yeah.
All right. Did you get it started?
Yeah.
She is done.
So it's live and actually
Oh,
moving?
because I accidentally bumped it, so yeah, it's now live. I'll take it.
Tony, you can speak
Yeah, but
without
Carol, I
microphone,
didn't
right?
know.
Oh, thank God.
She didn't run it by any of us, so we have no idea who she's planning on giving the candidates
So
to.
many technical
That's why I was gonna
So many.
go back and say who's it for, but
Since
I
we don't
didn't.
know, I said I'm taking
Hello, everyone. Okay.
Oh,
So we're having some technical difficulties today. The projector that we normally have has gone MIA. The HDMI cable to the TV is only 6 feet long, so we're winging it. The projector doesn't exist, so we're actually live streaming tonight from my cell phone. So if the connection is spotty, for those of you live streaming or watching the next day, I do apologize. It's the best we could do on the limited notice we had. My name is David Green. I am the president of the Katy Lions Club and Foundation. Thank you all for coming in person and for watching virtually either today or in future days. I wanted to introduce my leadership team, and then I also wanted to go through a couple of updates and changes that we've made. My service chair isn't here, so I'm going to end up doing that section as well. So again, my name is David Green. I am the president. Lydia Osuna, who is my first vice president, she's actually visiting family in California, so she's actually attending it virtually. Then I have Tawana Goodwin, who is my second vice president. She's also my education chair. Maddie Thigpen is currently home. She's not feeling well right now. She's my secretary. Then we have Treasurer Sue Green. She's actually my mom. She's amazing. Obligatory, gotta say it, because she is. She's the only one who keeps me in check 100%. Again,
that forever.
yes, that's the plan. She's gonna do that forever. My service chair again is Tiffany Walker. Then I have a brand new position that's being added to the board. The board of directors just voted on doing that today. So I'm going to introduce that one in a minute. Then we have Chris Bowman, who is our head of our 50th anniversary committee. Daniel Lee, who is the Childhood Cancer Awareness Coordinator. Diabetes Awareness is J.D. Shipley. Hispanic Outreach is Estella Yanez, who is currently in El Salvador. And so she's actually currently doing outreach in El Salvador. So yay! The healthcare coordinator is Constance Jones. She's a representative with the Texas Black Caucus. We have Kiva Mackey with Children Like Lonnie, who is our hunger coordinator. Leo advisor rounding up the Leo team is Caswell Jones. He is currently fighting traffic to get here from the school that he teaches at. New Communities is Alexandra Lowe. We have our past club president. I wish we could call her immediate past president so that we could have her on the board of directors, but she's transferred to lend her support to the Berkshire-Patterson Lions Club. Nevertheless, she's in my heart, Carol Barnett. And then Latricia Garman is our vision coordinator. The two new positions that I wanted to announce today. First, We Serve doesn't have exceptions. It's not something that we blindly say. It's not something that has boundaries. It doesn't have conditions. Service, it's an act of love. Of loving your neighbors. I actually wrote this down, so I'm just going to read this. It's easier. Of loving your neighbors, your friends, your coworkers, and of the person in the street. Service doesn't have a gender. Service doesn't conform. When you serve, you take pride in yourself because you know that you've improved the lives of the people surrounding you and you've bettered your tribe. As a 50-year-old organization that is part of a 117-year-old association, we have traditions. And after discussion with the board of directors, I am appointing Leo Angela Go to the board of directors in the capacity of safety officer effective September 14th when she officially transitions from Leo to Lion. So give a round of applause to Angela. Then also, so I'm actually tasking Angela this year with considering all of our practices, all of our activities, everything that we do, and ensuring that everything is all inclusive, not exclusive. It's welcoming and not welcoming and inviting, not exclusionary and not hostile. So thank you again, Angela, for stepping up and agreeing to do this. Additionally, I have named Tammy Howell to the position of Assistant Secretary. This is not a board level position, and that's okay, but it is on par with the advisors and the coordinators. Secretary Maddie asked me to appoint someone to help her and support her, and After our vetting, we chose Tammy. She's been in the Katy community for decades, so obviously she makes sense. Come on in. So yeah, so those are the two people that we are appointing to the board of directors.
These two people that you're appointing
So yes, these two lovely, amazing people.
that came in.
No, these two that just came in. Hello. Welcome to the Lions Club. Okay. So now I am going to introduce Courtney Long. Courtney is with Love It Group Texas Select, and she is an amazing friend of mine, and she is the reason we're able to be in this space today. So Courtney.
Thank you. Thank you for having me. I appreciate it.
Thank you for being here.
Thank you to David for inviting me. Thank you for sharing your time with me today. So welcome friends and neighbors, and I'm just glad to be here tonight and have a chance to talk to you guys for just a few minutes. So I am Courtney Long. I'm with Love It Texas Select, and I have been an insurance agent for 20 years. So I've been around a long time and seen a lot of stuff. So a couple of things I wanted to talk to you guys about tonight. I'll be pretty brief, and I will have some business cards in the back, and I will hang around and chit chat with anybody that wants to ask questions or talk later. But just really some facts and figures for you guys. When it comes to shopping for insurance, there's really a really big realm out there, from things from A to Z. So there are things that cover a lot and things that don't cover a lot. We want to make sure that when you're shopping for insurance, we want to educate you on what to ask for. If you don't know anything about insurance and you haven't done it for 20 years like I have, then you don't always know what questions to ask. So starting with homeowners insurance, one of the things that you always want to ask for is the #1 claim in Texas and in the U.S. currently is wind and hail. The #2 claim, though, and wind and hail is covered on most policies, unless you're a coastal county here in the Houston and surrounding areas. There are some counties here closer to the coast that don't cover wind and hail. But when it comes to homeowners, the #2 claim in Texas and in the U.S. is non-weather related water damage. And a lot of policies out there don't cover any water damage at all. A lot of them cover just a little. And then there are great policies out there that cover everything. So you want to make sure that you ask, what does my policy cover when it comes to water damage? Does it cover faulty, leaky roofs, windows, and doors? Does it cover accidental leaking from plumbing? Does it cover if my washing machine backs up? Does it cover if my sewer backs up into my home? You want to make sure you ask all of those questions because those are important things. I know we're here to talk a little bit about health tonight with Tony, but honestly, when you're talking about insurance in general, it kind of all pertains to your health, whether it's your home or your auto, because if you're not protecting your financial health, you're not going to have great health. It'll lead to stress and other things. So it's a little bit of everything for you guys. So does anybody out here know if their homeowner's policy covers flooding? No policies cover flooding. That's right. But you'd be surprised that 53% of Americans don't actually know that. And that all of us live in a flood zone. It's just a matter of risk. There's low risk and high risk. But just 1 inch of water in your home can cause up to $25,000 in damage. So make sure you're looking at flood insurance. And if you haven't looked at it, I know that it's gotten more expensive. October 1st of last year, Flood rolled out a new program. And I know that it's more expensive, but I promise you, it's worth it to have it. So if you have any questions on that, definitely give me a call and let's talk about it. The next thing I want to talk about is auto insurance. Everybody in here drove here or got here in some form of transportation, right? Most of you drove your own cars. Some of you may have ridden with somebody else. But when it comes to auto insurance, the average price of a vehicle on the road today is $48,000 and some change. So the Texas state minimums are 30, 60, 25. So there's 3 numbers when we talk about liability insurance in Texas and anywhere. The first number is going to be your bodily injury per person. The second number is going to be your bodily injury per incident, so for the total incident. And the third number is going to be your property damage. That's how much your policy will pay out in the event that you have an accident. If you go with the state minimums in Texas and you hit just one vehicle and it's an average cost vehicle at $48,000, you're not going to have enough insurance. So make sure we're taking a look at all of your levels of insurance and your liability. Just some important facts to talk about. I'll be here for the remainder of the meeting. Like I said, I'm going to stay after. I'm going to hang out and chit chat with you guys. I would really just like an opportunity to talk to any of you that have questions. If you have a policy that you'd like to go over, I'd love to go over it with you and educate you just a little. Honestly, a lot of people just go in, they get a quote, and they're looking for the bottom price. And we want you to have the best rate, but we also want you to have the best coverage. We don't want you to have a claim later on in life and be so disappointed that your policy didn't cover the flood you thought it covered, or that it didn't cover your vehicle to be replaced, or the other person that you hit, or that you didn't have water backup on your policy and it cost you $50,000 in coverage that you didn't have. We've had those claims. They happen every day, unfortunately. So it's my goal to educate people and to be a part of the community service and hopefully to be a Lion sometime soon. Thank you guys for having me this evening. I really appreciate your time.
I love that cherry on top right there. Okay, so I need Tawana to come up here and I need Angela to come up here.
You do?
I do.
Moi? What did I do, Carol? I'm always in trouble. I had to turn you in. You turned me in.
This is for you. You're not gonna get to keep it. All right, so one of the things, come here. Don't run away.
Yeah, really. You gotta make me keep moving the camera here.
All right, so once again, this is Tawana Goodwin. This is the amazing lady that sorry about that. This is the amazing woman that I was talking about. She is my second vice president. She is also our education chairperson. What that means, she's in charge of our LEOs. The LEOs are our 12 to 17-year-old young people. The LEO stands for Leadership, Educate, Excellence, and Opportunity. So we want to give all these kids an opportunity to succeed, to learn, to grow. That's why we're doing things a little bit differently with the LEOs this year. We have, what are we up to, 6 advisors in total. Yes. And she is in charge of that mega team. Now, I don't think I've ever heard of a LEO club in the past that's ever had more than 2 advisors. We are changing things up because we want to give these kids an opportunity to really succeed. And speaking of giving these kids an opportunity to succeed, as part of the role as the LEO advisor, primary LEO advisor as far as LCI, Lions Club International, is concerned, she gets a pin. She gets pinned. She gets stabbed with
love.
Now, yes, with love. Now, because this is such a beautiful blouse, I am not going to go ahead and stab it into the blouse. Instead, oh, we can do it? Okay. Instead, I'm going to have Angela, who is Leo Angela right now. I promise you didn't have to speak. Yeah, I promised you didn't have to speak. I didn't promise you didn't have to do anything. You gotta be careful. Careful what you agree to.
She didn't agree to anything. You just told her to come up there. You drafted her.
I did do that, I did. Okay. Yes, I'm a very big fan of voluntelling people. Voluntold.
Which means
Volunteer, maybe.
delegator.
Drafting.
Okay, I have no clue. Yes, it'll work. Okay. Here you go. Oh, right.
Now you just threw it on the floor.
You know what? This isn't working for me, so I'm just going to put it in her hand and she can stab herself. Anyway, thank you again. Once again, this is Tawana. If you haven't had a chance to talk to her yet about how you can be involved in working with our young people, reach out to her.
Oh, please do.
Okay, you can look at that now. I love you.
Is it a pretty
And of course, I had a whole speech written, but then I kind of just forgot about it.
What? Oh.
I forgot. No. I'm going to wing it. I winged it. All right, we're good. I wung it.
Actually, he had the speech already for last month, but you didn't come.
I wing-a-dinged it.
But it's all right, because we didn't have a real here last month. This month we did.
Earlier today, this applies mostly to, this applies specifically to our members, and that includes our associate members. At the board meeting that we just had earlier this evening, we as a board voted to advance 4 amendments to our Constitution and bylaws to the membership. All of our members have received a copy of these Constitution and bylaws that we've actually approved to be advanced. Officially, the official documentation will go out on actually tonight, and the official voting will happen on September 15th. So I'm not going to go ahead and read the specific verbiage because that's not necessary. Just suffice it to say, all of our members, you have received the actual documentation of what the amendments look like. You've seen what it was to what we want it to be and why we're changing it. And then at the actual voting, it'll be a case of you guys get to decide if you agree with us or not. And of course, if you don't, then it doesn't necessarily have to pass. Just because I say we should do this doesn't mean we will automatically do this. So that's that. I'm spending a lot of time up here. So sorry. Tiffany was going to be here to talk about the upcoming service projects that we have going. Unfortunately, she isn't feeling well. She has a sore throat. Something's going around. I think I should probably be avoiding everyone right now, which is never going to happen because I'm just too much of a social person. So, if you visit our website at www.katylions.org, yes, got to do that obligatory plug, you will see all of the things that we have coming up. There are flyers for the next, I want to say, 10 or 15 things that we've got going up. Wow, with your shiny mask. All right, I see you.
This is for David, y'all. This kitty.
So we also have a calendar.
Oh,
Things that are happening. We have later this month, actually next weekend, the Leos are going to be installing their new officers. And I don't know if that's going to be an open thing or not. That's going to be a Tawana and her Leos to decide that. Then on September 24th, we are hosting the Katy Health Fair, which is going to be at the historic the historic downtown plaza in Old Katy. And that's going to be from 11 in the morning to 3 in the afternoon. And then some of us are going to be coming over here to FCC Katy's Drag Bingo. So yes, I'm excited about that. That's not a Lions Club thing, but I'm just kind of obligatory. I love these people, so I'm going to plug it. We're meeting here. We kind of got to plug them a little bit. Let's be honest here. Then next month we have Daniel Lee. Daniel Lee is a lawyer. He's going to be talking about the recent legislative changes that have happened at the state level and what that looks like for us. That's going to be October 6th, and then October 7th, 8th, and 9th. The city of Katy has us working with the Rotary Club we're actually providing the carnival to the Rice Harvest Festival this year. And then later in October, we're going to be participating in the Katy Heritage Society's Vintage Carnival. And we are going to be manning and staffing and running the temporary tattoo station. So those are just some of the bigger things. We have a lot of other smaller things coming on. Take a look at our website again, www.katylions.org. So yeah, those are all things we want you to show up for, participate in, etc. I'm tired of talking right now, and I'm sure all y'all are tired of listening to me. What's up, Carol?
You want to mention the USA Canadian leadership?
I don't, but you can.
Yay, Carol. Well, you can.
Come here. I don't know anything about it.
Carol, it's just the leadership.
Come here. Okay, I'm calling up Carol. Carol is the zone chair for one of the other zones in our community.
I just wanted to mention that September 14th through the 18th is the USA Canadian Lions Leadership Forum, and it's in Calgary, Alberta, Canada this year. I will be going because I get my master's degree this year there. So, but all are welcome. It's a great place to meet other Lions from all over the world, actually. So it's time to book your flight and get in on it. So thank you.
Thank you.
Thank you, Karen.
If you have questions, you can reach out to Carol if you're here in person, or you can put a comment on on this video, and we'll get that information to you, Carol, so she can get back to you.
Yes,
Carol,
okay.
you are now
Okay.
you have now kind of been set up as the person who is our contact for that.
Okay.
Anyway, so as I was saying, I'm pretty much done talking at this point. I've talked way too much. I had all these breakups, but it didn't happen. So instead, I'm just going to go ahead and say, Tony Francis, this guy's amazing. He knows Medicare. He knows what's going on. Even if you are not able to take advantage of the program like me, you know someone who can, like some relative that I'm not going to mention. So without further ado, Tony Francis from MediPlan Max.
Tell them you're too young for this.
I'm not, unfortunately. I have to sign up next month.
I don't know how I'm going to follow those two, but I'm going to try.
I know, right?
Very hard. Okay. Everybody can see this okay? I have to do this, I guess. Can y'all see okay if I'm over here? Yeah. Well, like he said, my name is Tony Francis. I'm with MediPlan Max. What does that mean in English for you? It means I'm a broker. I've been a broker for 20 plus years. In other words, I've been in the insurance industry for 20 plus years. I found the ins and outs, ups and downs, and some things I liked and some things I didn't. And I sat down with a guy once upon a time, he told me, if you want to be truly happy in anything you do, find yourself a niche. And I didn't have a clue what he was talking about. But when I kept going to all these different events, and every time I walk in, there was always somebody doing P&C. There was always somebody doing financial planning. There was always somebody. And I got tired of walking in for somebody. And the guy sat me down and said, find yourself a niche that nobody wants to do. And the one common variable that was, no matter where I went, no one ever said they did Medicare. Oh, that's too hard. No, it's not. So my little slogan has become, I will teach you about your ABCs and I will make it easy as 1, 2, 3. Okay? I'm going to start from the beginning because the beginning is way back when we all were born. Once upon a time, you could go to the gas station and you can get water and it was free. You could get air, it was free. It ain't free no more.
And they even washed your windshield when you got the gas.
Thank you. I'm saying all that to say this. I know everyone here may have a TV. Everyone here may have a radio they may listen to. And for the last 24, no, I can just say the past 36 months, 7 days a week, you've been hearing the same thing everyone else has been hearing. Free, free, free. Call 1-800, free, free, free. Come get your free benefits. Free, free, free. Ain't nothing free. That's a lie. I'm going to tell you about the lie. What is Medicare? Medicare is federal insurance eligible for U.S. citizens. What you mean? I got to be a U.S. citizen? Yes. You also have to live in the States for 5 years or longer. What else do I have to be? Well, you also have to be 65 and older. Do I? Not necessarily. If I'm declared disabled by the state and been on disability for 24 months, guess what? I'm eligible for Medicare. People don't know that. But the other fine print that they don't tell you about is not Social Security. That's a whole other ballgame. We don't even want to talk about that right now. It is not Medicaid. Medicaid is for people who are disabled or low income. And the bottom line, you see what that word is? See that word right there? That one word right there? I think I've said it a couple times. It ain't free. And I use ain't because it's improper English. I think I cheated. Went ahead. Like I said, you must be in the States for 5 consecutive years. You must be a U.S. citizen, age 65 or older, younger 65 with a qualifying disability, and any stage, any age with ALS or end-stage retinal disease. Okay? When do I become eligible? It's 3 different periods. You have a 7-month window that people don't worry about when you turn 65. 3 months before, 3 months after. I tell everybody straight up, don't you worry about after. I want to talk to you here. You want to get your paperwork in here. Because if you don't, Uncle Sam has this thing called a penalty, and he just loves giving it away. Okay? You can enroll yourself online. We're going to SSA.gov, and when COVID hit, all the offices were closed, so everything we were doing was online. Right now, they're finally getting some of the offices open. I would say they got some trained people back in there, but the best way to do it right now is still do SSA.gov. Okay? Things you might want to think about. What if I'm still working? What if I'm still on my company's plan? Do I still need to sign up for Medicare? No. No. Only thing that's going to be automatic is your Part A, but we'll get to that in a second. But if you're still working, you already have credible coverage. Why pay twice for the same thing?
That's right.
I'm going to hit you in a second. Medicare comes in 2 parts. Part A, Part B. Part A covers your hospital. When you go in the hospital, they give you a bed. Part B covers you when you go see the doctor. All your doctor visits, okay? What they forget to tell you is that Part A, luckily, has no deductible, premium. You know why? You already paid for it. Remember FICA?
That's what we
You
paid for.
paid for it. But it's not free, remember that. Part B also has a premium. It is based on the last 2 years of your income, your gross income. So if you made $89,000 or less for this year, your Part B premium is $170.10. People say, what? I thought it was free. Ain't nothing free. But then, here's the other fine print that I forget to tell you about. They have this thing called 80-20, something like what you have right now with your insurance, with your health insurance. They'll pick up 80%, you're responsible for the other 20%. You say, what? Oh yeah. And they also, the other fine print they don't tell you about is that when you go in the hospital, that's the deductible. $1,556. You know what that pays for? That pays for the hospital bed only. The doctor, that nurse, anesthesiologist, that nasty food that you shove down your throat, the medicine, that's your 20%. So if you go in the hospital and your bill is $100,000, you better have $20,000 in your back pocket. If you don't, guess what? The bad thing about this also, they get you all well, they kick you out of the hospital, 45 days, you go back in, guess what happens? You pay it again.
There you go.
They kick you out 30 days, say you're healthy and wealthy, 6 months later you go back in, you pay that $1,556 again, you pay that 20% again. In other words, there's no max on it, it's unlimited. And people say, I don't know about you, but I don't have $100,000 I want to give to somebody that's not taking care of me the first 2 times. I don't want to go through my retirement account, I don't want to go through my nest egg. Part B also has a deductible. Good thing about this one is, it's only $233 one time. So the first time you go visit that doctor, guess what happens? The first $233 is out of your pocket. After that, you pay 20%.
That's the first $233 per year?
Per year.
Per year. Yeah.
One time. A lot of people, they add this up and they add it up and say, wait. I can't afford all that. Exactly. That's why they give you options. Option 1, option 2. I got a friend in the back gonna help me with option 2. I'm gonna cheat, I'm gonna go back. Part A, like I said, 0 premium. So when people turn 65, your Part A is kicked on, boom. And people don't care because it's not costing me anything, I don't care. But when you go in that hospital, the first 60 days, you pay that $1,556. You stay in there past 60 days, you're paying $389 per day.
Oh.
Till they kick you out. If you go past 90 days, then you go into your reserve account. That's 778. And you say, oh, man, there's no limit. So like I say, if you go in the hospital 3, 4, 5, 6 times in a year, you're paying it. Like I said, I don't have $100,000 to give anybody, I'm sorry. It's your Part B. Like I say, based on your income, $89,000 or less, your monthly premium is $170.10. And unfortunately, last year, that went up to $170.10. Prior to that, everybody was grandfathered in. I knew people that were grandfathered in at $94, $100, and they were barely scraping. And
Yeah, my husband's was
that.
106.
So they
Yeah.
bumped them up to that. Everyone's saying, now how am I going to pay that if I couldn't pay the 95? You pay the $233 one time. But after that, you're paying 20%, and once again, no out of pocket. So whenever I look at this scenario, they say, I can't do this. That's why they give you options. Option 1 and option 2. Option 1, I call it the alphabet soup. It's called the Medicare Supplement Plan or the Medigap Plan. Why I call it the alphabet soup? Because when you talk to people about the alphabet soup, they say, oh, I got the G. No, I got the Y. No, I got the X. I got the N. I got the Z. They got an alphabet. They can't tell you what it does for them, but they got an alphabet. They got an alphabet. As you can see, across the board, all the plans are standard. They all kind of do the same thing. And when I say standard, it doesn't matter if the name is Aetna, Blue Cross Blue Shield, Cigna, Humana, United Healthcare. They're all the same. A is a, B is a B, a D is a D, they're all exactly the same. What the difference is, it's like back in the day when we had Sony TVs and Zenith RCA. The name, the price. Second option, we call it Part C, or the Medicare Advantage plan. The advantage of this plan is the fact that it combines your Part A and your Part B and your Part D all rolled into one picture. So tell me the fine print. The fine print is, with this plan, I'm not paying at $1,556. With this plan, I'm not paying at $233. With this plan, I'm not paying at 20%. Oh, really? Yeah.
It's a good plan. What's it costing me though?
I'm not there yet. I gotta go back.
You don't want to do that.
With this plan, remember the supplement plan? That covers your A and your B, right? It covers your 1556. It also covers you 20%. It doesn't cover you 233, and it doesn't cover your Part D, your drug plan. The other downfall of the supplement plan, it doesn't offer you vision, dental, hearing, transportation, and the most important thing that everyone says they gotta have it, they can't live without it, the gym membership.
That nobody
Sit down with
uses.
people and they will give up glasses for a gym membership.
And they never
They
go.
will give up hearing aids for a gym membership. Wow. And they'll never darken the doorstep. You gotta have that gym membership. I said, okay, why? Okay? Like I said, with this plan, that's the reason why it's an advantage. Dental, vision, hearing, gym membership. It also comes in two forms, HMO, PPO. HMO, everybody knows, HMO plan, you gotta do what they tell you to do. You gotta see their doctors, their hospitals, their clinics. You can't deviate from it. There's no option. Then there's a PPO plan, where you can see any doctor that accepts Medicare, any hospital that accepts Medicare, any clinic that accepts Medicare. It sounds a lot like a supplement plan, doesn't it, teacher? That's another thing people don't realize. As long as the doctor accepts Medicare, you're good to walk and roll. If they don't accept Medicare, you're in trouble.
So do you have to ask for the Advantage plan?
I'll get to you in a minute.
Well, I got it.
Yeah, no, but I'll tell you.
Oh, okay. I just remember how I got it.
I know how you got it. I know exactly how you got it.
You're paying for it. You must know where I live.
I do. I know you're Heather's mom now. I know.
Yeah, oh no.
Like I said, the Advantage plans come in HMOs, BPOs. They have a point of service. Everyone knows what point of service is, right? That's when you go to the checkout counter, they got all these goodies sitting there by the cash register, and you pick something up. Same principle. It ain't no cheaper. Cost you more, but easy access. Okay? And then we also have what's called a special needs plan. That's for someone like my disability people, someone who has Medicare and Medicaid. That's for them. But we don't care about the other two. Medicare open enrollment period starts October 15th through December 7th. Okay, that's your time to look at your plan. What I do with my clients, in fact, starting today, they all got email, they all got a postcard, and starting tomorrow, they'll get a phone call. And what I do with that phone call is called time for annual review. Why do I have an annual review? Well, before I sit down with anybody to sign them up for anything, there's three things I have to know. Who's your doctors? Why is that important? Because not every doctor accepts all plans. Doctors quit. They die. They retire. The second thing I need to know, what medications are you taking? Why is that important? Well, 9 times out of 10, you're retired. You're not getting that weekly paycheck, you're not getting that bi-weekly paycheck, you're not getting a monthly paycheck. Now you have what's called a budget. You know that budget where you gotta have a budget for the car, and a budget for electricity, and a budget for the food, and a budget for the rent on the mortgage, and a budget, and a budget. Now, what used to cost you $5 and $10 at the pharmacy, if you walk up there and they tell you it costs you $100 to $200, what bill is not going to get paid?
Probably food.
And that's the medication that you need. That's not going to work. So I'm going to make sure I'm going to find a plan that's going to give you the same discount. And the third thing I always check, what's your history? What do you mean history? Heart attack, stroke, diabetes, cancer. Why is that important? Because I'm going to make sure whatever plan we're working with, it's going to be able to take care of you no matter what comes up in any situation. And I do that every single year. Why? Doctors quit, they die, they retire. Medications go on and they go off the formulary. You may go on a new medication or you may come off a medication. And you came in my office today, you're healthy as a horse, the expression. But 3 or 4 months from now, all of a sudden now, high blood pressure, high cholesterol, diabetes. We gotta look at it again. Are we in the right place? So when January walks in, and you walk in that doctor's office, and you put your card on the table, and he says, oh, we don't take that. Who you wanna kill?
You?
Exactly. It's not gonna be me. Because I'm gonna make sure that you're in the right place at the right time. We also have what's called open enrollment. That's from January 1st to March 31st. There have been situations, there have been times where we signed somebody up doing AEP, October 15th to December 7th, and all of a sudden come January 1st, they walk in, and all of a sudden that doctor quits, or he retires, or he decides, I'm not gonna take that plan. We can switch you. That's my time to make sure I can find you a plan that's gonna take care of you, or find you a doctor that's gonna take care of your needs. Nobody knows about this. Then the third enrollment period that's out there is called the special enrollment period. That's when you move. I've had 3 people this week move from New York, California, to this area. Guess what happens? They thought they had a good plan. No, they didn't. That plan stayed in California. That plan stayed in New York. They needed a Texas plan. So we had to switch them. All of a sudden, I got Medicare and Medicaid. They get a new plan. All of a sudden, the plan discontinues. They get a new plan. That's why they call it a special enrollment. It can happen anytime during the year. Anytime. That's it. People try to make it more complicated than what it really is. They will Google till the cows come home. They'll go down and ask your uncle, aunt, sister's brother, every question under the sun. It doesn't work that way. Every year, everything changes. Right now, I'm doing more certifications. I don't know what to shake a stick at. My brain is going, whoa, whoa, whoa. But the good thing about it is, when I sit down with somebody, I know what's going to happen. I know what I'm talking about. And I know I can help them.
So what do you recommend? What was the bottom line?
Doctors,
Yeah,
medicine,
everything.
history.
Right, but I mean the advantage.
Doctor, medicine, history.
And then he customizes
Because
it to what's
it's not
best for you.
customized. Because then, I'm gonna go back again, if I can get this back.
Well, not necessarily customized, but makes the better recommendation what fits you.
Yeah,
Yeah, but is that the advantage point?
Yeah.
this is how I do that. When I sit down with somebody, I ask them, there's always my number 4. My number 4 is always, what are you looking for? You know, when I was a kid, there was a candy called An Hour Later. Anybody remember that candy?
Oh, yeah.
Okay. And I asked them straight up, I say, do you want to pay a little bit now, they have no surprises later? Or pay nothing now, they have a big surprise later? Remember, there will be a cost for the GAP plan, supplement plan. The Advantage plans, HMO plans, 0 premium. PPO plans starts at $10 up to $99. Once again, depending on the name. Aetna, Blue Cross Blue Shield, whatever. And so when I sit down with people, I look at this situation. But what's really going to decide which direction I'm going? Number 3, heart attack, strokes, diabetes, cancer. That determines which direction we go. Because I'm not gonna put you somewhere.
And those items that you just said, like the heart attack, victim stroke, that's like immediate family history, like parents,
Or
siblings,
you.
or personal?
Yeah.
Yeah. Okay.
Because the bottom line is, my goal is to make sure that you can be taken care of from now until. Period. No ifs, ands, or buts about it.
You know, they keep trying to put me on the diabetes thing, and that doesn't take care of everything else that I've got, because I've got, you know, multiple things going on. And they keep saying, oh, you got diabetes, well, let's put you on this. And it's like, no.
Does anyone else have a question? This concludes my presentation. What you just brought up was a HIPAA violation. I can't talk to you in an open forum, but you and I can talk one-on-one.
Okay.
I forgot to say that initially. Individually, I can't tell you yes, no, or indifferent. One-on-one, we can talk till the cows come home. Because there could be a guy back there with a real tape recorder recording everything I'm saying and report me to HIPAA.
There you go.
And we are live, so yes.
Yeah.
There you go. Great
And
job.
since-
Good disclosure.
David, how do I stop this?
Thank you, Tony.
Just hit the finish button, or what? You conclude first.
Finish is fine. That's fine. Thank you, everyone, for coming out.